Okay, so hello everyone. Today we'll talking about the nephrotic syndrome. So what is nephrotic syndrome actually? Nephrotic syndrome is the disease of kidney in which the body pass too much protein. So first we will talking about the basic principle of nephrotic syndrome. Actually what I mean from the basic principle mean these principle will be present in all type of the nephrotic syndrome. So this is actually very important. I will give this a star. So okay, so I have mnemonic for this 4h. So we'll divide these 4h into 2 hyper and 2 hypo. So okay, first one is hypoalbuminemia. So when there is low level of albumin, it will lead to the decrease in oncotic pressure. So what is oncotic pressure? Actually oncotic pressure is the pressure which favor in reabsorption. So when there is a decrease in reabsorption, then it will lead the capillary to leak. So when the capillary leak, it will cause the pitting edema. So be careful and remember that in nephrotic syndrome there will be a pitting edema. So okay, the second one is hypogammaglobulinemia. So when is pretty easy when there is decrease in immunoglobulin, so it will increase the risk for infection. So remember that there will be increase the risk in infection in the nephrotic syndrome. So this was the first one, which is hypo. Okay, the second one is hyper. Okay, the hypercoagulable state. Why there will be a hypercoagulable state? Because there will be the loss of antithrombin 3. And what is the function of antithrombin 3? The function of antithrombin 3 is it inactivate the thrombin and factor 10. So okay, there will be a hypercoagulable state. The second one in hyper is hyperlipidemia and hypercholesteremia. So again this is the most important one because it will lead to the fatty cast in the urine. So again remember that there will be a pitting edema in nephrotic syndrome, there will be increased the risk of infection, there will be the hypercoagulable state, and there will be a fatty cast because of the hyperlipidemia in the urine. Okay, so note the proteinuria in nephrotic syndrome will be greater than 3.5 gram per day. Sometime in scenario type question they written in that form, that 4 plus, and that form, or they simply write that plus 4 plus. So are 3 greater than 3.5 gram. So this is the most important. So again there will be a proteinuria which will be greater than 3.5, there will be a fatty cast, there will be increased risk for infection, there will be a pitting edema, there will be a hypercoagulable state. So this is a very important point. Okay, now let's talk about the type of nephrotic syndrome. Be careful, you have to memorize the type of nephrotic syndrome on the tip of your finger. Like there will there is a minimal change disease, focal segmented membrane nephropathy, and membrane proliferative glomerulonephritis. Actually this is co-present as both nephrotic and nephritic syndrome, but we will clear this point that we have to differentiate these from the membranous nephropathy. And there is a diabetes mellitus and systemic amyloidosis. So this is the type of nephrotic syndrome. So okay, now let's go through some MCQs that clear your points. Okay, So this is the 48-year-old male have a history of HIV and obesity. So he have a bilateral pedal edema. So this is the main point. As I told you earlier, that the patient will have a pitting edema and periorbital puffiness. Okay, the urine dear show the proteinuria and fatty cast, and this is the most important one. Again, this one is important. Actually, this one is also important. So if we have a renal biopsy, what will be the histological result? And the right option is nephrotic syndrome. Pretty easy.